I ran into a person that I'll call Mrs. Smith, and I'm engaging with her. She's talking about a long-term history of shoulder pain that has already failed a rotator cuff procedure. As I questioned her, she begins to describe to me symptoms that don't fit the profile of a rotator cuff problem. She begins to define not only her shoulder pain, but her associated hand numbness and tingling. So as I began to examine the neck and apply the treatment methods that I knew were appropriate, within the next 48 to 72 hours, her symptoms change dramatically. Shoulder pain dissipates, hand numbness and tingling goes away. Confirmation is there, it's obviously a neck problem. Third visit comes back and says, I'm 95% better, and in this visit, she's with her mother. And her mother says to me, I just want to thank you for what you've done for my daughter. You don't realize this, but I've had custody of her child for the last year because she's addicted to opioids. Here I had a woman who had suffered unnecessarily for a year, been exposed to procedure after procedure after procedure that was actually directed to the wrong body part. And all I had to do was ask a few simple questions to figure out that she had a problem that was not associated with the shoulder, it was associated with a different body part.
Thinking about how traditional medicine takes care of our patients, it's not necessarily wrong, it's just the way we were taught and we want to try to help them. The problem with getting an MRI is that it's probably going to show something, but is it actually what's causing the problem?
We had one company, their head of benefits has already had, it's a gentleman who's already had back surgery, and he had his second back surgery scheduled. We recommended that they talk to Chad's group. And he calls from Seattle down to Tallahassee and talks to one of their trained clinicians over the phone. They were able to diagnose over the phone what was causing the back pain better than an MRI. They gave him a set of exercises and it cleared his back pain up.
Typically you hear about going to a primary care and being referred to a specialist who eventually is going to lead down the surgical path.
What we've seen is that we really have been able to save people a lot of trouble, a lot of unnecessary imaging, unnecessary procedures by using IMC.
We either are affected by joint pain or we know somebody, so yeah, I think it has a lot of value.
When I push far enough back, I get pain in that finger, and that's mechanical pain. And there's no way to mitigate that pain with a muscle relaxant, an anti-inflammatory, an opioid, an injection. I certainly don't need a surgery. How do I get rid of my finger pain? I take the pressure off the structure. We don't have the capability of changing mechanical pain with chemical interventions. It doesn't work, which is why we have the opioid crisis right now.
They took the standpoint of, we're working with all these employers, what is it that we can do to help improve healthcare and improve the lives of families?
You no longer have to figure out how to cobble together 3 or 4 solutions. It's an integrated solution that fits within the employee benefit plan.
But the environment has to be created for healing, and the only person capable of providing that environment is the patient. That's why self-care is actually the most important component of our program, because if I'm not teaching people how to mitigate their own problem and how to manage it themselves, we never win.